Hi parents! Today I want to chat to you about what happens if your child's pediatrician is recommending 40 hours of intense therapy per week for your child and your child is only 3 or 4 years old. My name is Nanette. Thank you for joining. I studied to be a teacher. I've been working in the field of special needs and particularly autism for the past 15 years, and I'm also a mom to 3 cool kids. I make weekly videos on topics related to autism, and we are all about sharing easy to implement practical strategies with you as parents or teachers. So today we are speaking about what happens if your child's pediatrician is recommending 40 hours of therapy per week for your child and your child is only 3 or maybe 4 years old. If you're listening to this video, you may feel that this is something that is unheard of, but unfortunately it's not. If you have a child diagnosed with autism, it is something that you may have come across already, and I'm wondering, if you're watching this video, let us know in the comment section below. Have you been faced with this situation? Has someone recommended 25 to 40 hours of therapy per week for your child? Let us know by commenting. You can just comment yes or no, whether this has been recommended to your child. So what if this happens? What are things that we need to consider? And at the end of this video, I'm going to share one very important thing that is usually missed when we are considering and thinking about support and therapy for our young children and for any child regardless of that age, really. So if you think of your child, there may be areas of development, or even it can be something that you've been noticing, or it can be something that a pediatrician or a professional has pointed out to you. Areas where your child may need more support. And that is real and relevant and necessary, often necessary, but there are certain things that we need to consider. So if you know that there are areas of development where your child does need support, it is important to consider what are you going to be focusing on first, and is it worth it to be considering intense therapy such as 40 hours of strict therapy per week. If you have a young child, 3 or 4 years old, 40 hours of work is a full work week for adults. And it's not normal for any child to be expected to be engaged in 40 hours of work or therapy per week. Children's main task should be to play and to learn through play. Why do we want to change that for our children, even if our child does have a diagnosis? So what we would suggest is to go and look at your child. And maybe you don't have a child with a diagnosis, but you are noticing some differences in your child, which is making you wonder whether you should be speaking to a pediatrician about these things. And if so, we have a video, I'll put the link in the comment section below. We have a video that you can't miss. Go and have a look at it, because in that video, I shared 3 really important things that you need to know before you go and do a visit with a pediatrician. 3 things that you need to share with a pediatrician to make sure they have a clear and a complete picture of your child when you are speaking to them about your child and considering support going forward. So don't forget to look at that video. The link will be in the comment section below. So back to 40 hours of therapy being recommended for our 3 or 4 year old child. What we would suggest is to go and look at your child in particular and identify and get some advice if you need to, but identify the 2 or 3 most important areas where your child needs support right now. So for example, if your child is having a really hard time to communicate his needs or wants, communication is something that we all need, and every child needs a way to effectively communicate. So that would be definitely worth it to go and see a speech pathologist to help you find strategies to help your child improve his or her ability to communicate. Perhaps you have been noticing that sensory issues is a big thing for your child. And then we would definitely suggest, if that is a big challenge for your child or in your household, go and see an occupational therapist who specializes in sensory integration so that they can give you guidance in this regard. But go and identify those 2 or 3 main things and work on those things before you consider something like 40 hours of intense therapy per week. Remember, our kids are still kids, regardless of whether they have a diagnosis or not. Something that I would love to share with you, and this is something that is usually missed when we think of our child and the way they learn. As I've said, kids learn through play, but how are we going to incorporate that with our children making the necessary changes and developing in the areas where they do need support and in the areas where they do need to develop and grow more? So the one thing that I plead with you to consider is your child's strengths and interests especially. Our kids thrive when their interests are involved. When our child is interested in something, that is when they learn. That's when they are engaged. That is the things they remember and the things they want to learn more about. They're in a good space. They're happy. They want to be part of the learning, and their energy levels are even increased, heightened. They want to be part of their learning then. So that is the one thing that we would love for you to consider, and I'm begging you to consider that, your child's interests and strengths, and make sure that whatever type of therapy or support that your child needs and whatever you are going to incorporate for your child to grow and develop, make sure that your child's interests are at the center, at the core of those support strategies, because then it will have a lasting effect, and then your child will be happier, first of all, but also more engaged and actively part of this learning process, and the development will also be a positive experience for your child himself. So don't forget to let us know in the comment section whether this is something that you have come across. Has it been recommended for your child to be engaged in 25 to 40 hours of intense therapy per week? Yes or no? And take a look at that video that's going to help you prepare for your visit with a pediatrician. Remember to consider your child's interests in everything you do to ensure that optimized learning process.